see about osteology of head and neck. So, what is osteology of head and neck? It is mainly the study of the bones. So, bones of head and neck include the skull, that is, skull with mandible, 7 cervical vertebrae, the hyoid, and 6 ear ossicles of the ear. So, ear ossicles are not visible outside because they are inside the ear. So, they are malleus, incus, and stapes. So these are ear ossicles. They are also included in the bones of head and neck, but most of the authors doesn't write them. So in BD Chaurasia it is mentioned in bones of head and neck. The skull cap formed by frontal, parietal, squamous, temporal, and a part of occipital bones developed by intramembranous ossification. So skull cap, which is the upper part, it is developed by intramembranous ossification, and base of the skull, it is ossified by intracartilaginous ossification, which is a two-stage process. So intramembranous is one-stage process and intracartilaginous is two-stage process, because first there will be a cartilage that is converted into bone by deposition of the bone, and then it is ossified. So base of the skull is intracartilaginous in ossification. Then next, introduction of the skull. It can be divided into two main parts, that is calvaria or brain box. The brain box is the upper part of the cranium which encloses the brain. Facial skeleton constitutes the rest of the skull and includes the mandible. Okay, then we'll see calvaria and facial skeleton. Total altogether there are 28 bones. In that, in calvaria, the paired ones are parietal, temporal, malleus, incus, and stapes. Unpaired are frontal, occipital, sphenoid, ethmoid. The facial skeleton is composed of 14 bones. So, in that, paired ones are maxilla, zygomatic, nasal, lacrimal, palatine, inferior nasal concha. Unpaired are mandible and vomer. We'll see all this in the further upcoming slides one by one, but first we'll go in brief about the introduction and in total the views, how it looks from above, side, lateral, and all. So sutures, types of sutures. Plain internasal suture. Example for plain is internasal suture. You can see there, it is just attached in the plain lines. So suture is one which merges the bones. So there are so many bones which are merged with one another with these sutures. Then interparietal suture is serrate. Okay, I'll show you in the next slide what is parietal bones. See, here there is frontal bone, parietal bone, and occipital bone, and also there is temporal bones in the sides. So the parietal bones, in between them the suture is serrate. Then denticulate for lambdoid suture. So the parietal and occipital bones are merged with the lambdoid suture. This suture is denticulate in nature. You can see that lambdoid suture here. Okay, I'll use the pointer. The pointer is okay, it's okay, we'll see it later. Then squamous parieto-temporal suture. So here you can see here temporal lines. Okay, that is a suture between the parietal and the temporal bone. It is squamous. Okay, then norma verticalis. What is norma verticalis? From the vertical view, it is called as norma verticalis. Okay, the exterior of the skull we are studying now. So in that there are 4 sutures, that is coronal suture, sagittal suture, lambdoid suture, and metopic suture. Okay, you might be knowing what is coronal suture. So coronal suture is the one which is joining the frontal bone and the parietal bone. Okay, in between them there is a coronal suture. Then sagittal suture. Sagittal suture is in between two parietal bones. Then lambdoid suture. Lambdoid suture is we were studying just now, denticulate, is denticulate. Lambdoid suture is denticulate. So lambdoid suture is in between parietal and the occipital bone. Metopic suture. Actually, this metopic suture is not present in everybody. It is present rarely, like in 3 to 8% individuals. It is just a line. It is in the median, which separates the two halves of the frontal bone. It is present only in 3 to 8% individuals. The metopic suture. And we will see about other features in this view. Norma verticalis. So vertex. What is vertex? It is the highest point on the sagittal suture. Here you have seen the sagittal sutures right here, and even in the next slide you can see sagittal suture. The highest point in this sagittal suture is vertex. Then vault of the skull. What is the vault of the skull? Vault of the skull is arched roof for the dome of skull. Okay, it is a roof of the skull. Okay, it is called as vault. Then bregma. Bregma is the meeting point between the coronal and sagittal suture. Here in this previous slide you can see bregma. It is the meeting point between the coronal and the sagittal suture. Then lambda. Lambda is the meeting point between the sagittal and lambdoid suture. So here sagittal and the lambdoid suture, the meeting point between them is called as lambda, which is marked with a pencil. You can see here. Then parietal foramen. It transmits emissory vein. Then obelion. Obelion is a point on sagittal suture between the two parietal foramina. So I have marked here with a pencil. You can see obelion. And one more thing was parietal foramen. So parietal foramens are located in the parietal bone, and obelion is in between the parietal foramen. Then norma occipitalis. So what is norma occipitalis? From behind you can see norma occipitalis. External occipital protuberance is a median prominence in the lower part of this norma. The most prominent point on this protuberance is called the inion. Sorry, that is spelling mistake. That is inion actually. Then superior, shall I tell the spelling of the inion? I-N-I-O-N. Okay, the most prominent point on this protuberance is inion. Inion is actually, it is a multiple choice question. It was asked in the competitive exams, NEET exam. Then superior nuchal lines. They are curved bony ridges passing laterally from the protuberance. Okay, you can see here superior nuchal lines. Okay, and inion I have written there with the pink color pen. External occipital protuberance, in that you can see inion. Okay, prominent point. Then mastoid foramen is located on the mastoid part of the temporal bone at or near the occipitomastoid suture. Okay, mastoid foramen. You can see here mastoid foramen. It is located mastoid part of the temporal bone near the occipitomastoid suture. Okay, this is occipitomastoid suture. You can see other markings there: sagittal suture, parietal bone, parietal foramen, lambda, lambdoid suture, squamous part of occipital bone, nuchal lines, then occipitomastoid suture, inferior nuchal lines, mastoid process, mastoid notch. This is seen in norma occipitalis. Then next we will see norma frontalis. What is norma frontalis? From the front view, what is seen is called as norma frontalis. So the superciliary arch is a rounded curved elevation situated just above the medial part of each orbit. So what is in front view? You can see superciliary arch. So what is superciliary arch? I guess the picture is missing over here. I'll add that picture. Give me a minute. So norma frontalis, superciliary arch. So you can see here. I think this is a little blur, but it's okay. See, that is a superior orbital fissure. Okay, above that it comes superciliary arch. It is a rounded curved elevation situated just above medial part of each orbit. Okay, the openings of the eyes, which is round in shape, that is called as orbit. Above that is superciliary arch. Then glabella is median elevation connecting the two superciliary arches. Okay, in between there, which is written as 2 over there comes glabella. Okay, the nasion is median point at the root of the nose. At the root of the nose you can see nasion. Frontal tuber or eminence is a low rounded elevation above the superciliary arch. Okay, above the superciliary arch is frontal tuber. Then here in this picture you can make out, I have marked some important points, that is zygomaticofacial foramen, inferior nasal concha, intermaxillary suture, zygomatico-maxillary suture. So these are all important. I have also written here Renion. Okay, it was a question somewhere, so I had written that. Then mental tubercle, you can see here mental tubercle, it is actually inside, can't see actually from this view. Then next slide we'll see orbital openings. So supraorbital margin is formed by frontal bone. Okay, the one which is above the orbit is frontal bone. So above in that supraorbital margin is present. The infraorbital margin is formed by the zygomatic bone laterally and maxilla medially. Okay, here you can see zygomatic bone here. So in that region there is infraorbital margin. Attachments. The procerus muscle arises from the nasal bone near the median plane. Okay, muscles, there is a picture in the next slide, you can see here procerus. So the procerus arises from the nasal bone near the median plane. Then the orbital part of the orbicularis oculi arises from the frontal process of the maxilla. The orbicularis oculi muscle, it arises from the frontal process of the maxilla. Can you see the orbicularis oculi muscle? Then levator labii superioris alachnesi arises from the frontal process of the maxilla in front of the orbicularis oculi. So in front of the orbicularis oculi you can make out there is levator labii superioris alachnesi. Levator labii superioris, it arises from the maxilla between the infraorbital margin and the infraorbital foramen. Okay, levator labii superioris alachnesi, levator labii superioris. Are you able to see? These diagrams are important. So to fetch the marks in the exams, you need to draw diagrams, not just marks. In total, they see mainly the diagrams. In anatomy, diagrams are very important. Then levator anguli oris arises from the canine fossa. Okay, levator labii alachnesi superioris, can you see? It is arising from the canine fossa and it is arising from the levator anguli oris is arising from the canine fossa. I think levator anguli oris is not mentioned here. Then next coming to norma lateralis. Zygomatic arch, the anterior end of the upper border is called the jugal point. Okay, in the zygomatic arch, okay, this jugal point, it was asked somewhere in the multiple choice questions, so I had written on that jugal point. it is in the zygomatic arch. Okay, what is jugal point? Jugal point, anterior end of the upper border, so zygomatic arch. Okay, anterior end is called as jugal point. Posterior end of the zygomatic arch or zygoma is attached to the squamous temporal bone by anterior and posterior roots. Posterior end of the zygomatic arch is attached to the squamous temporal bone by anterior and posterior roots. Can you make out? Then external acoustic meatus. In lateral part we have studied about zygomatic arch, then external acoustic meatus. So in this suprameatal triangle is the important question. Okay, it might be a 2-marker question and it was asked in the multiple choice question in competitive exam. It is nothing but a small depression posterior superior to the meatus. The suprameatal spine may be present on the antero-inferior margin of the triangle. Okay, can you see suprameatal triangle? Okay, in that suprameatal triangle we can see suprameatal spine. The triangle forms the lateral wall sutures meet. So asterion is it marked over here? Yeah, see this point where all the, sorry, there is terion which is marked, which is written over here, asterion. Wait, I mark that asterion. I guess I'll just find out. Okay, mastoid part of the temporal bone. Asterion is the point where the parieto-mastoid, occipito-mastoid and lambdoid sutures meet. You can see here I have written in the pencil asterion, where all the bones are meeting, parieto-mastoid, occipital and lambdoid sutures, they all are meeting, that is called as asterion. Okay, and other than that there is terion. Terion is the point where temporal, frontal, parietal bones meet, that is terion. Then what is temporal fossa? Temporal fossa is nothing but it is present in the lateral side. Okay, one which is marked there with the pencil is temporal fossa overall. Okay, so in that the floor is made up of, anterior part of the floor is crossed by an head-shaped suture where 4 bones, that is frontal, parietal, greater wing of sphenoid and temporal, adjoin each other. This area is termed terion. Okay, where all these bones are meeting, it is called as terion, and this is the floor of the temporal fossa. You can see here temporal nerve and arteries, that is temporalis muscle which is brownish, and this is masseter muscle. Okay, that is the lateralis, norma lateralis. In norma lateralis we see this. Then norma basalis. What is norma basalis? From the base of the skull you can see. Okay, this is the foramen, palatine process, greater palatine foramen, lesser palatine foramen, vomer, zygomatic arch, foramen ovale, mandibular fossa, carotid canal, mastoid process, jugular foramen. Okay, jugular foramen, I have written something between occipital and petrous part of temporal bone. Okay, jugular foramen is situated between occipital bone and petrous part of temporal bone. Then for condylar fossa, below that I have written condylar part of occipital bone. Then this is opistheon. Okay, in that foramen magnum the posterior most point is opistheon. Then you can see scaphoid fossa. Okay, the fossa in total middle part of the norma basalis is scaphoid fossa. There you can see foramen spinosum, foramen lacerum, and for pterygoid canal. These are all situated. I have written squamous part of occipital bone. The one which is posteriorly situated is squamous part of occipital bone. Then you can see the maxillary arch, that is alveolar arch of maxilla, intermaxillary sutures, palatomaxillary suture, interpalatine suture, pyramidal process of palatine bone, palatine crest, posterior nasal spine, anterior part of norma basalis. This is the anterior part of norma basalis. Then we will see, here we can see the vomer bone, okay, that is ala of vomer, then vaginal process of sphenoid, the palatine bone, medial and lateral pterygoid. In that palatine bone you can see perpendicular plate and horizontal plate. Okay, this is a coronal section of the nasal aperture. Okay, this is a posterior view of the nasal aperture. Then here you can see norma basalis. In that norma basalis, the middle part they are showing it in the wide view. Hence you had seen the norma basalis over here, right? Here you saw the norma basalis here, and this is the middle part of the norma basalis. And that again they have given the other markings, other important points they have labeled there. Then you can see next point, attachments in the norma basalis. So in that, muscles which are attached are splenius capitis, longissimus capitis, sternocleidomastoid muscle. Okay, then you can see rectus capitis lateralis, rectus capitis posterior major. Rectus, it is like we are telling some army or soldiers name, no? Like rectus capitis major, rectus capitis posterior minor, obliquus capitis superior, semispinalis capitis. So you can see all the muscle attachments in the norma basalis. Then here you can see infraorbital foramen, supraorbital foramen, lateral pterygoid, mental foramen, masseter muscle. In the next upcoming videos we will learn about the foramens and vessels or nerves passing through them. Okay, till then, take care, bye bye, share, subscribe my channel and share. Thank you.